Thanks, Elizabeth. Getting a second opinion can save your life, but many people worry that getting a second opinion is checking up on their doctor. That's not the case at all. The fact is, medical decisions often boil down to judgment, and different doctors may arrive at different conclusions. In some cases, they could all be right, medically speaking, but it may not be the most right for your particular situation. All doctors, even specialists, have personal preferences based on their own experiences, and they tend to recommend what they know best. Some other reasons to seek a second opinion: if you have a rare cancer, if you live in a rural area, if you have an HMO. You can also request a second opinion on the pathology report from which the diagnosis is made. Lastly, if your pathology report doesn't give a definite diagnosis, a second opinion is definitely in order. Let's find out what University of Michigan hematologist-oncologist Dr. Harry Erba has to say about the importance of second opinions in formulating the treatment plan. Just as experience and knowledge matters in everything, it especially matters when our lives are at stake. To put it bluntly, if your doctor has little or no experience in treating your particular type of cancer, it's a risk to put all of your confidence in him, and the only way to find out how many cases he's treated is to speak up and ask. As Ronald Reagan said, trust but verify.
When a person is diagnosed with malignancy, this is a life-altering diagnosis, and care should be practiced in making that diagnosis, being very careful, making sure it's the right diagnosis and a treatment plan. And so it makes sense to get a second opinion for such a major decision. But let me give a few practical pointers along the way, because at first glance that sounds easy, get a second opinion. But if the second opinion is the same as the first, okay, now you have two people thinking the same way, I should probably go ahead. But how about if the second opinion differs? And if the second opinion differs, then the patient is stuck in the middle, because the physicians are not going to say the other guy's wrong. The physicians are going to defend their recommendation. And then it puts the patient in a difficult spot where then they get a third opinion or a fourth opinion. And I've seen people get multiple opinions and honestly waste a lot of time in doing so. The thing about clinical medicine is there are often many ways to take care of one problem. I mean, we try to find the best way, but there could be different ways of approaching a problem. And so I think it's very important for the patient to feel comfortable with the physician that they find. It makes sense that you go to a physician who has expertise in specifically that area. We are sub-specializing in, for example, in academic medicine in the variety of malignancies. And so it makes sense that if you are diagnosed by a community oncologist and pathologist, to get a second opinion in an academic institution where the physicians tend to be specialized, meaning they've just seen more of the same thing and may have more experience in that patient's particular disease. And if you get a different opinion, you may then trust that opinion somewhat more than the first opinion. But it could be overwhelming for patients when they get multiple opinions and they vary, and how do you, at the end of the day, decide who is correct? And frankly, I think there is no good way, and what a person has to do is look at the reputation of the institution, look at the reputation of the physician, and and this is, as I said, a life-altering diagnosis. Look at your relationship with that oncologist and decide, is this somebody I feel that can not only get me through this initial diagnosis, but is going to be able to help me along the whole path I'm about to set upon.
Once you have a diagnosis, it's important to learn exactly what the diagnosis means. Gather information on treatment options and make sure you understand the medical recommendations. Seek out the best experts you can find and work with a physician you feel comfortable with. And don't be afraid to seek a second opinion.